Now, I also have parents that come in and say, I came to you because I want to use the most natural option for my child's treatment. I went to another dentist, I saw that he has the case, or I have noticed in the past couple of weeks that I've been brushing my kids' teeth that there's a big hole on a tooth, and I wanted to come in and get it checked, and I wanted to get the most natural options for the tooth. And so a lot of the times parents can also be confused in what that actually means. So my question is, are you looking for the most compatible material for your child, or are you looking for non-metal options for the child when it comes to pediatric dental procedures? And sometimes parents know what they're looking for, and sometimes they don't. Sometimes there's a little bit of confusion. So as far as natural options, nothing is going to be as natural as what God gave us. I mean, nothing's going to replace or be exactly like our natural tooth structure. So once that tooth structure is gone because of decay, or because there was a fracture, or for any other reason, there's nothing that's going to act as a natural option to replace the missing part of that tooth. So when it comes to this misconception, as far as natural options, we need to figure out what that means as far as what the parents are looking for. And so when it comes to a tooth looking as natural as possible, then is when a tooth filling material is going to come in. If a tooth has a cavity that can still be repaired using a tooth colored filling material, then that can be a great option. If a child has a cavity on a tooth where the cavity is too big, or it has gone on for too long, and the option to do a filling is no longer there, then we're going to go to a crown for the tooth. And a crown is something that covers the entire tooth. And when it comes to crowns for pediatric patients, they come prefabricated already. And there's typically two options. There can be more, but we're going to stick to two for simplicity right now. So there can be the stainless steel crowns, and there can be the new smile zirconia crowns. And that's just one brand of them. There's different brands, but typically you have metal crowns and you have non-metal crowns. And so when the parents ask me which one is best for my child, that's going to be a tricky question to answer without doing any further testing on the patient. So something that I may be very compatible with, your child may not be. And so that just comes to the individual reactivity of the body towards material. When it comes to stainless steel crowns, the components of it are going to be mainly nickel, chromium, strontium, iron, and manganese. And so if a child has an allergy to any of those metal components, then obviously stainless steel crowns are not going to be the best suited for that child. If a child has allergy to any of the components in a zirconia crown, and basically the zirconium is going to be the component in zirconia crowns, then they're not going to be the best candidates for those crowns. So it just depends what a child is more biocompatible with and what they're not. That determines which material is best for them. When it comes to what is best for the child as far as biocompatibility, it is dependent on each child's individual biocompatibility, and there's different tests that can be done for that. So I just wanted to clarify that because it can be confusing. Now, if a parent wants non-metal options for treatment of their kids, those can be presented. But if a parent wants what is the most compatible with their child, then we have to go into further investigation with other testing when it comes to materials to determine what the specific child is most biocompatible with. And I hope that makes sense.